Okay, so after the preparation of this, you want to turn on your ultrasound machine, use the straight transducer probe. We use the Philips Lumify with your tablets or ultrasound machine. And you want to identify your anatomy. You can identify the internal jugular vein. If they turn their heads to the left, we're using the right technique right here. In the posterior approach, I'm placing the transducer probe on the vessel, and you can see right here the internal jugular vein bouncing, compressing. It is not pulsating at all, okay? So after getting everything set up, making sure that you have maximum barrier sterile technique, you want to anesthetize them. There's local lidocaine. You will follow the same track to make sure that they don't have any pain. And then you also want to make sure you inject subcutaneously because you will be placing a suture at the end, okay? So you'll infiltrate at a 45-degree angle, start proximally, and you'll want to see part of your needle real close to the probe. So it starts showing up on the screen, bevel up. And then now you can see it cannulating inside of the vessel. You can track it a little bit, and you know you're in if you're getting fluid coming out. Okay, so you have proper placement with the needle. Now you're going to want to place your guide wire. So you want to straighten the tip and place it directly into where the needle is. You should not have a lot of resistance, and you'll want to thread that in. Please keep an eye on the cardiac monitor just to make sure that you don't have any ectopy. If you're having slight resistance, you could try twisting a little bit as you're entering. So you thread that in, part the way through, you remove the needle, okay? And then you place a small nick. Please don't do this on our mannequin, okay? Subsequently dilates the track. Okay, so you place that all the way in. Place your finger there. They will be bleeding at this point. And then you'll want to place the actual triple lumen catheter. Keep threading it through until you can see it coming out the back end of one of the lumen. And you can see that right here on the white one in this case. And then you want to thread that through the line that you cannulated with the dilator. Once it's in place, you remove the guide wire. Make sure to always keep an eye on that. You'll want to draw and flush in all of the lines. You'll know you're in the vessel if you do see water or blood in this coming out. You'll place the caps on, which may be available separately, onto each of them after you've drawn, and then you'll want to flush them subsequently. Okay? Suture it in place, place a topical Tegaderm dressing, and then it is up to you, since you place this line, to get a chest x-ray to confirm placement. Proper placement, it should terminate right above the right atrium or the superior vena cava, and you just want to make sure that you do not have a pneumothorax after the procedure. Thank you very much.